Good morning and welcome to the WAVY Digital Desk. I'm your host, Sarah Good. Today we're going to be talking about National Stroke Awareness Month with Riverside. We have Dr. Aaron Daly here today to talk about some of those signs and symptoms, what to do in the case of stroke, recovery, risk factors and so forth. Thank you so much for joining us. If you have any questions, please feel free to put them in the chat on Facebook and YouTube. If you're joining us on WAVY.com, there are resources on there as well as more information from Riverside and from the CDC and other resources. So I'm going to bring on our guest now. Dr. Daly, thank you so much for joining us this morning.
It's a pleasure to be here.
Well, I know that as a part of, Riverside neurology specialists and, specializing in stroke, would you mind just talking a little bit first about what a stroke actually is for the people that maybe don't understand, the mechanics behind it?
Yeah, I love that question because it comes up all the time. I think stroke is, we think about it in the brain, obviously, but you can stroke anything. And what stroke really is death of tissue in the body. Obviously, my team gets concerned when it happens in the brain, but you can stroke anything. And so to kind of set the level there, you could stroke your heart. There's a whole name for it. It's called a heart attack. But this is National Stroke Awareness Month. And so we're going to talk about stroke in the brain. And how does that tissue die? It's because of lack of oxygen or lack of sugar or a combination of both to those cells. And when that happens, the brain can't tolerate that for a very long period of time. And if that blood flow is not restored, you will have damage to the brain, and that's what we call stroke.
And at that point, when that occurs, and then maybe we'll get into some of, the factors and symptoms maybe in a second, but when a stroke actually occurs, what's the window of time like there where you can maybe act on it or treat it properly?
Yeah, in 2024, you would think we'd have plenty of time, but we don't. So 4.5 hours from the time that it's sort of noticed that there's a problem is really the sort of maximum amount of time that we have the opportunity to intervene with a medication. There are surgical procedures that can be done up to 24 hours after first noticing a symptom. But the sooner the better, because realize that brain cells are dying in the millions per minute. And every brain cell that doesn't survive is disability. And so stroke is, while it's the 5th leading cause of death in the United States, it is one of the leading causes of disability in the United States. So surviving a stroke can leave folks profoundly disabled. And so time is critical.
And are those symptoms obvious enough? If you're with people, is that key, having people sort of notice, or are there ways to notice it within yourself?
Yes, both. And so I think, we do a really good job here teaching people what the signs are, but by the time they get here, often that's too late. And so highlighting on that with a sort of memory device called BFAST is kind of where we try and teach folks out in the public, and that BFAST stands for changes in balance, changes in your eyesight, droopy face, usually on one side, but it can be both. Arm weakness, slurred speech, and that's the B fast part. And then the fast part would be time. And that we've already highlighted, but again, it is critical because if you notice those, you need to come see your closest emergency department or dial 911. I mean, preferably 911, especially if you're by yourself, because you're not necessarily safe to drive, and that's a key point.
Right. So. And at that point where you're sort of feeling those symptoms, you need to act fast and go to the emergency department or, your local, you have your local 911 team, whether that's, first responders or, the EMS show up. What is that process like getting to the hospital, getting it checked out? Are you all immediately, noticing those symptoms when you get to the ER and administering medication? Is it a little bit more complicated than that?
Well, I mean, at its most fundamental, it's not more complicated than that. I mean, we're at Riverside Regional Medical Center here in Newport News. We're what's called a comprehensive stroke center, so we can treat everything, right? And our EMS partners, and this goes for the same on the south side. There's stroke centers down there, but our EMS partners start doing those assessments while our patients are in the ambulance, and so you're actually getting that assessment before you even show up. And often we will know about the patient before they even arrive. And the reason that we want that is because, again, time is critical. And we train on this about 24 to 2,500 times a year at our hospital, because that's how many people come in. And it's a very safe, but if you look at it, hectic looking event. We're analyzing if this is a stroke, if it's a bleed in the brain, and we're taking people to get pictures of their head. The goal is to get that medication inside the body within 30 minutes of arrival, and so it's fast paced.
And like levels of a heart attack, I know that there are ones, Widowmaker, that you've heard of, that are the worst. But does a stroke work similarly? That there are different levels of stroke?
There are. And so in the brain, we break up stroke into two major categories. The hemorrhagic strokes, or the bleeding strokes, is when you bleed into the brain. And those are significantly more dire as far as consequences go than the other type of stroke, which is ischemic stroke, which is the fancy word for lack of oxygen. It's important to note that both of them will have lack of oxygen, but the bleeding strokes tend to cause more death and significant disability than the non-bleeding strokes or ischemic strokes. And we can't do much from a medicine standpoint for the bleeding strokes. We can for the blood vessel being blocked, the ischemic stroke, by giving a medication to break up a blood clot that could be in a blood vessel. We can also surgically remove a blood clot if it's in a vessel that's large enough. And again, that's that 24-hour period. But in general, you need to get to us as fast as possible.
And let's talk. Oh, sorry, I don't want to cut you off. Go ahead.
Go ahead.
I was just going to say, at this point, what are some of those things that put you maybe at higher risk for stroke? So I know that women have a higher risk, certain groups can have a higher risk, but in general, what are those maybe lifestyle factors and then also, genetic factors?
Yeah, I think, in the United States, those are even shifting a little bit. But I always, when I'm teaching residents, have like a trick question. The number one risk factor for stroke in the United States is stroke. So if you've had a stroke before, you're more likely to have it again. But in general, we're talking about, and you can see people on the screen, smoking is certainly a high risk factor for stroke. The good news is, from a public health perspective, fewer people are smoking, but that doesn't mean that it's still not a huge risk factor. But high blood pressure, high cholesterol, diabetes, something called atrial fibrillation, and a kind of a newcomer, but doesn't mean it hasn't caused strokes in the past. We're just recognizing it more and more as obstructive sleep apnea, which is a breathing pattern in your sleep where you stop breathing multiple times an hour. And then, this always comes up, is obesity a risk factor? And the answer is not in and of itself. However, if you have obesity, you are more likely to have high blood pressure, diabetes, sleep apnea, and these other types of issues. And so certainly in 2024, like I was saying, you have a brief period of time to get to our hospital to get treatment. And we're really good at that. But the lion's share of the work of stroke in 2024 is prevention. And so from that standpoint, managing those risk factors, having a good primary care plan for those, it's that old adage of an ounce of prevention is worth a pound of cure. And so we encourage folks to be active in their own healthcare and ask these questions about what their risk factors are and how they can be controlled. Because while I love taking care of people, I don't want to see you, right? I want to make sure you're having a stroke in the first place, because that's going to be where your disability will be less, right? So.
And while you can't control maybe some of those genetic factors, if you're just predispositioned to have maybe, higher cholesterol, or, you have certain cardiovascular problems, there are definitely things you can do in that scheme, in that sense, to have a better outcome, right? Is that, going to the doctor when you need to, getting tested, making sure you're on the proper medication.
Yeah. And I think you bring up a good point, and it's a public health concern sometimes too. Is there's not very good access to care sometimes, and so folks who would otherwise go to the doctor and can't necessarily get in to see the doctor. We need to be doing a better job as a health system and getting care to the people who need it. And we're working on that certainly at Riverside, but as a public health system as well. But yeah, I mean, those preventative sort of routine maintenance, as you will, actions are going to serve you well. But it's hard. It's hard. Like I think we could talk probably for hours about nutrition, for example, but that is super important. But and not trying to get too far off field, but it's expensive to eat well sometimes. And so those are real public health concerns that will help impact the stroke rate in the United States. And so we're getting out into the community and doing grassroots efforts. Newport News just designated as a stroke smart city. And there's lots of efforts and lines of effort that we're doing outside the hospital for prevention.
And thanks for bringing all of that up, because there are groups that are disproportionately affected, and some of it is community-based, as you said. So, whether or not that's reaction time for people calling 911 and getting to care quickly, obviously that also is a distance problem, to your nearest medical center or whatnot. In Hampton Roads, you have places where they are a certain distance away from, especially a trauma 1 care center or, a stroke center.
And anybody who's lived in this area for more than 5 days understands the bridge and tunnel situation as well. So these barriers that other cities don't necessarily have, we do. And so strategically, we put our stroke centers in places that serve the public the best. And we operate on what's called a hub and spoke model. And so if you lived in Gloucester, for example, and you had a stroke, our hospital in Gloucester is really good at treating strokes, and they'll send them to us at the regional hospital if they need higher level of care. And so that's not unique to Riverside per se. That is an initiative that's been going on for several decades. The NIH had sort of pioneered that model, and so it's a best practice.
And I want to talk too, there are some people who they look healthy on the outside at least. They look like they're fit, they're doing everything it seems they can in their lifestyle, but they still could get a stroke. And I've known, stories especially of women where that is the instance, and they look perfectly healthy and have good, again, daily choices. In that case, I know that it's not one size fits all, but is that genetic? Do we know why women have a higher chance of stroke?
So it's a great question, and I think the science is sort of pointing towards potentially there's more evidence that like autoimmune type of diseases are more prevalent in women than men, and certain autoimmune types of diseases will make you more susceptible to having blood clots, for example. Certainly lupus comes to mind, and but regardless, there's also a different hormonal sort of makeup, obviously, between men and women, and estrogen in particular seems to be a more potent chemical when it comes to creating blood clots, and there's probably some basis behind that in child birth and whatnot. But so I think just off the bat that makes women more susceptible, and so we're certainly sensitive to that. I think, in general, we have sort of a formula when you walk in the door of is this stroke or not? We run through a bunch of tests to get there. So from our perspective, we're sort of blind to that. But I think that that's a very common thing with heart attacks too. Women they quote present differently than men, and so our research is just still ongoing.
And when you go to the
Yeah.
doctor too, you hear, obviously big side effect for different types of birth control, especially they ask you too, do you have a migraine with aura? There's all these questions that you get, but birth control, obviously on the label right there, it does say increased risk for stroke, or that's what the OBGYNs, will tell you.
So that's an interesting point, and I think certainly that is true. I think the American College of Obstetrics and Gynecology, or ACOG, put out a statement a while back, because the types of birth control that people are on right now are what they call low estrogen birth controls, and so that is in an effort to mitigate the risk of blood clots and strokes to an extent. And so it's not as bad as it used to be, but again, it's still a risk factor that we have to be aware of, on top of other risk factors. And to your point about genetics, I always tell folks you can't fight your genetics, you can't fight the makeup of who you are, but being aware of those factors that are out of your control is still useful. But it's really those modifiable risk factors. And I love what we're seeing on the screen here with these diets. That looks like a Mediterranean diet to me. I'm just guessing, but the nuts and sort of olive oils and such, and then the exercise. So if you do have some of those genetic risk factors, keeping on top of them, what we call modifiable risk factors, is your best strategy.
And, this is just some sort of general video that's playing, for everyone watching, just about good cardiovascular health in general, which is huge. I know that we're seeing a cigarette on screen right now. There are so many things, I guess I just want to mention this. There are so many things right now besides cigarettes that kids are still using, right? And we have different tobacco products. I think Zen is a big one right now, vapes and all that kind of stuff. Just to make clear, that is all a part of having good cardiovascular health. All of those products, no matter the traditional cigarettes or not, those all impact your cardiovascular health.
Yeah, there's no doubt that that's the case. I think, certainly putting things inside your body that aren't supposed to be there is just in general not a good plan from a philosophical standpoint. But that's a difficult challenge sometimes, and I think the science, because it's relatively new, these vapes and these sort of volatile chemicals that you're putting inside your lungs, we don't understand all the implications of it. But there's some pretty good evidence right now out there that suggests that it's actually more harmful than traditional cigarette smoking from a lung perspective. But if you're impacting the lungs, by extension, you're going to impact the heart, which then impacts the brain. So I think the cascade that occurs, particularly at this earlier age, is going to be interesting to see in the next 40 to 50 years.
And one of the last things I want to ask you, and you brought it up a little earlier, about the recovery afterwards and, disability that can occur, by way of the stroke. Can you just talk a little bit about what either your patients have gone through or generally what people go through afterwards in that rehabilitation part? Because that's the only part, I think, in this conversation, at least with the big, bullet points here, that maybe people don't understand or aren't aware of.
No, I think that's true. I mean, it's the after you leave the hospital, right? What happens? And so, from a medical perspective, we get people set up with follow-up appointments with neurology or with their primary care doctors and such. But really, the recovery is largely in the rehabilitation. So strokes tend to leave folks with some weakness at times, maybe some imbalance, difficulty walking. And right now we have a very robust, physical therapy and occupational therapy and speech therapy. You can have difficulty swallowing and speaking, right? And so we have a pretty robust program for rehabilitation. And you'll see maximal results typically within the first 1 to 2 weeks, but you may have some problems for long term. And so that will often be a very difficult decision for family members to make with regard to, well, where should my loved one be? Because maybe it's not safe at home. We tend to think of, and I'm going to speak mostly about right-handed people, but it's true for left-handed people. If you have a stroke on the left side of your brain, um, those folks tend to do worse than strokes on the other side of the brain, because that's where your language is. And if you're unable to communicate, I'm not feeling well, or I'm in pain, or I have a sore somewhere, to your loved ones, you may end up having an infection, or you may end up having other problems. And so education is the key. We have a tremendous education, stroke education here at our hospital, but that education has to extend outside the boundaries of the hospital. So that's where the lion's share of the recovery occurs, is not here. And that can be years of recovery. A lot of folks do well. And again, the risk factors for doing poorly are age, and before you come into the hospital, what your health was. And so it speaks more to keeping your health in check.
And, you brought up a point there, obviously, about what's known and what's not known, and, education outside of the hospital. I mean, I guess during National Awareness Month, how important is that for people to understand these signs, these symptoms, the timeliness of this? I think, people think of heart attacks more and more. People are learning CPR, they learn these things, but this is also an extremely important piece of cardiovascular health and care and urgency. And
it's complex. I mean, realistically, most folks, when they're having chest pain, they are like, oh, I'm having chest pain, I need to go to the hospital, right? When folks are having, maybe mild imbalance symptoms, that might not be a stroke, right? I mean, again, like all of us, I say this to patients all the time, all of us have had that experience where you stand up too quickly and you get a head rush or feel like you're about to fall, right? And while that might not be a stroke, if that persists for a long period of time, that shouldn't happen, right? And so it is complex, and we want folks to, frankly, recognize these signs with the be fast, the balance, the eyes, the facial droop, the slurred speech, et cetera, because we're kind of the experts, right? Come to us, we'll figure it out. And if it's not a stroke, great. But I would really encourage folks that if they feel like these symptoms are stroke-like, please come to the experts. Call 911, come to the experts. And hopefully it's not a stroke, but if it is, I would rather be wrong than be right and sit at home with a stroke, right? So
no, absolutely. And well, Dr. Daly, thank you so much. And I don't know if there's anything else that we did not get to, just like, any gentle reminders for people. But I think, you covered so many great things that both people can take care of on their own, but also things to either help a loved one or notice in themselves to get help as soon as possible.
Yeah, I appreciate the opportunity to help educate folks. We've got really smart folks in our community, so it's not even like that, but just time. Time is of the essence. And the faster you get to us, and the less disability, honestly. And so that's kind of why we keep preaching about the time. So
absolutely. Well, thank you to everyone watching with us. If you want to find out more about Riverside Neurology Specialists, you want to find out more resources, there's a whole list online. Go to WAVY.com. Again, the link is in WAVY's Facebook page and on YouTube, so you can find more resources there. But Dr. Daly, thank you so much for joining us this morning.
Yeah, thank you, Sarah. Appreciate you.